Thank you, Mr. President. We are entering into a new era in which 5 men on the Supreme Court are going to get to make decisions about what kind of health care you get as a matter of right, living under the protection of the laws of the United States, and what kind of health care you get as an employee at the whim of the decisions made by your boss. These are the kind of decisions that your boss should be making. Decisions about the direction of your company, decisions about the level of your salary, about new products that your business is going to offer. This shouldn't be your boss's decision. It shouldn't be up to your boss as to whether or not you, as a female employee, get access to prescription contraception or not. But that's the world that we live in today after the Supreme Court, in a 5-4 decision, has given the power to particular employers to deny women access to prescription birth control. Prescription birth control, contraception is used by 99% of women in this country at one point over their life. A big portion of those prescriptions are actually for purposes related to complicated medical treatments like cancer therapies. And no matter how the Supreme Court tries to explain this, there is no way to effectively differentiate what the Supreme Court has done on birth control with a whole nother range of potential discrimination. As Justice Ginsburg said in her dissent, this exemption that the Supreme Court has given for employers' religious beliefs would extend logically with religiously grounded objections to blood transfusions held by Jehovah's Witnesses, to religious objections to antidepressants held by Scientologists, medications derived from pigs, including anesthesia, intravenous fluids, and pills coated with gelatin held by certain religions, and even vaccinations, a belief held by Christian Scientists, amongst others. And the idea that the Supreme Court is now going to get into the business of micromanaging which particular religious beliefs that they are going to protect and which ones they aren't going to protect is unacceptable to the majority of people that I represent. And so that's why I'm here today to support the Protect Women's Health from Corporate Interference Act. It's pretty simple. All we're saying here is that employers shouldn't be allowed to refuse coverage, health coverage, that are guaranteed to their employees and their dependents under federal law. When we decide to pass a law with the majority of the House and the Senate agreeing to it, signed by the President, those protections should be available to all employees. It's not easy to pass a law and get it signed by the President. Founding Fathers set up a lot of pretty significant barriers to passage of any law, never mind a law that guarantees a certain level of health care coverage. And up until the Hobby Lobby decision, the Supreme Court had stayed out of that decision, said if the United States Congress decides that a minimum level of coverage should be available to employees, then employers shouldn't be able to get in the way. That precedent is now blown up, and there's really no going back, as Justice Ginsburg has said. I hope that we pass it this week. And the reality is that it's more important now than ever to protect this coverage, because as a result of the Affordable Care Act, there are millions more women, millions more families all across this country who have access to prescription contraception. 24 million more prescriptions for oral contraceptives were filled without a copay in 2013 than in 2012. That's by virtue of the protections in the Affordable Care Act. On this particular type of prescription alone, the Affordable Care Act has saved $483 million in out-of-pocket costs for oral contraceptives. That's saved a lot of families money, but that's also gained access to this important medication for millions of women. And Mr. President, it's just another example, just another piece of evidence amidst a mounting pile that tells us that the Affordable Care Act is working today. And so, Mr. President, I want to spend just a few additional minutes going over the latest litany of good news when it comes to the implementation of the Affordable Care Act. Republicans have kind of gone quiet, silent even in many parts of the nation when it comes to their critique of the Affordable Care Act. And that is in large part because on both sides of the aisle, there is a quiet acceptance that the Affordable Care Act is working. It has vanished from most campaigns as a political issue this summer and this fall because it is increasingly impossible, aside from anecdotal evidence, to make the case on an empirical, data-driven basis that the Affordable Care Act isn't working. So Senator Reid did a little bit of this earlier this week, but I want to share with you again some of the new numbers that we have. Here's maybe the most stunning number. The uninsured rate in the United States fell 2.2 percentage points in the second quarter of 2014. We now have the lowest quarterly rate of uninsured in this country since Gallup began tracking this percentage in 2008. There are approximately 20 to 25% less people and families in this country without insurance than 6 months ago. That is absolutely stunning that in 6 months of implementation of this act, we have taken 1/4 off the rolls of the uninsured in this country. Even the biggest optimists about how the implementation of the Affordable Care Act was going to go couldn't have guessed that we were going to take that big a chunk out of the rolls of the uninsured. But here's more evidence that this is working. 57% of the individuals who purchased coverage through the exchanges were uninsured when they were enrolled. So a lot of Republicans said, well, you know, the big numbers that you're seeing, 8 million people insured through the private health care exchanges, well, that must just be people shifting from one kind of insurance to another. Well, a Kaiser study says that, in fact, almost 6 out of 10 of the people who got insurance in the exchanges through Medicaid, through staying on their parents' insurance, had no insurance beforehand. Frankly, to my mind, it doesn't necessarily matter because to the extent that they went on these plans coming off of another plan, it was for a reason. They were saving money by and large, and that's a good thing in and of itself. But you have 4 out of 10 people going onto the new plans because it saved them money, 6 out of 10 people coming onto the new plans because they had no insurance at all, and they're getting care as well. A new Commonwealth Fund survey says that 60% of the adults with this new coverage through the marketplace or Medicaid reported that they had visited a hospital or a doctor or filled a prescription. And 62% of those people said that they couldn't have accessed or afforded this care previously. Right? That was the theory, is that there were all of these people who were waiting to get so sick that they had to go to the emergency room, costing us all sorts of money in the long run, that now can get preventative care. And of the 60% of people who went out and saw a doctor because of the new coverage they had as by virtue of the Affordable Care Act, 60% of them said that they would never have gotten that care had they not had that coverage. That's millions of people all across the country. We're going to have an injury or an illness. We're going to sit at home and live with it until it got so bad that they had to show up to the emergency room. They're now getting care. What about the premiums? People said, well, you know, these premiums are going to be unaffordable and people are going to start paying them and then stop paying them. Well, HHS did a survey of the premiums and found on average that the monthly premium that people are paying is $82 per month after a tax credit is factored in. Now, listen, $82 a month is not pocket change. There are a lot of families out there who have trouble even coming up with $82 a month. But for somebody like Susie Clayton, a breast cancer survivor from North Canaan, Connecticut, that's a big deal. She's paying right about that number, $90 per month. But prior to the Affordable Care Act, because she had a pre-existing condition, Susie Clayton was spending $1,600 per month. And there are hundreds of thousands of other Susie Claytons out there. Premiums are pretty affordable. Well, the critics said, all right, we'll concede that more people are getting covered. We'll concede that they're using the care. We'll concede that the premiums are affordable, in part because you're spending all of this money on premium assistance, but you're going to just start spiraling healthcare costs. Well, that didn't come true either. With April's updated CBO projections, spending on major federal health care programs, Medicare, Medicaid, and the ACA subsidies, has now been revised downward by $900 billion That's 0.5% of GDP since the 2011 projections. So in 3 years, CBO has pushed down its projections of 10-year spending by $900 billion. Here's an even more stunning way to think about this. So if you look at what CBO said we were going to spend on a per Medicare recipient basis in 2010 versus what they now say that we're going to spend on that recipient today over the next 10 years, that per Medicare recipient spending level has been decreased by $1,000. We're spending $1,000 less per Medicare recipient. Now, that doesn't have anything to do with the private exchanges. That has to do with all of the other provisions in the bill that start to shift healthcare spending away from a system that rewards volume, how much medicine do you practice, to a system that rewards outcomes. How good is the medicine you're practicing? Are you keeping your patients healthy? And so the reality is that spending is remarkably low, historically low on healthcare. Listen, admittedly, some of that is because of an economy that has been slow to recover over the course of the last 6 years, but a lot of that is because of the Affordable Care Act. So much so that I saw an article in the Wall Street Journal the other day, Mr. President, that said that the president was to blame for the slow economy because he had been so successful in pushing down the rate of healthcare spending that now it was a economic catastrophe that we were spending so much less than we had initially projected on healthcare. So there's no way for this president to win. If healthcare expenses spiral and premiums spiral, it's his fault. But if he does something to control healthcare premiums and healthcare costs, then it's a drag on the economy. In the long run, the truth of the matter is that if we get healthcare spending down, really just a transfer payment within our economy, then we have the room to spend more money on much more necessary investments in our infrastructure, in our scientific edge over other countries. So I'm here today to support the underlying bill because I think it's the right thing to do for women in this country, but also because it is part of a growing success story of the Affordable Care Act. $500 million saved on prescription contraception alone, but add that to all of the other evidence. And we're living in a world in which it is increasingly hard to argue that the Affordable Care Act is working. Millions more people covered, huge chunks out of the uninsurance rolls being eliminated, costs for overall healthcare expenses decreasing, and I won't even get into it this afternoon, but quality improving as well. Less people having hospital-acquired infections, having to be readmitted to the hospital. And the stories just keep on coming in. I certainly understand that on an anecdotal basis, you can find people who have had negative experiences with the healthcare system under the Affordable Care Act. But you know what? I could find millions of those people before the Affordable Care Act was passed as well. But there are many more people like Sean and Emily Hannon, who are two freelancers from Weston, Connecticut, who were looking for coverage previous to the Affordable Care Act being passed. The best that they could do was $1,500 per month from Golden Rule. And when they heard about the Affordable Care Act, they called up the Connecticut Exchange and they found a plan through Connecticut that was going to cost them $309 a month. This is a fairly young couple, a savings of nearly 80% compared to what they used to pay. That's the story that can be replicated millions of times over all across this country. We'd be wise this week to restore this protection to women across this country so that they have access to affordable prescription birth control. That is just one part of a growing, overwhelming array of both success stories and positive data about the implementation of the Affordable Care Act, proving that the ACA works. Mr. President, I would yield the floor.